Inflammation arises in the human body from a variety of sources, but one of the major sources of inflammation in all of us can be what happens when the bacteria within our intestinal tract receive a meal or foods that have very little fiber and have a very high carbohydrate density. This particular pattern of eating or of meals generally forms an imbalance within the intestinal tract where we'll have too many of a particular family of bacteria which can generate inflammatory molecules such as lipopolysaccharides and not enough of the beneficial bacteria which can thereby process the fiber to what we call short-chain fatty acids. This is, in essence, fermentation, and having the right bacteria within the intestinal tract and giving them fiber to work on a regular basis allows us to produce one of the most important anti-inflammatory substances in the body. So it's really important to look at the fiber in our meals or in a particular food as a critical ingredient for reducing inflammation and for supporting the microbiome or microbiota in the fashion that we want it to. So fiber is anti-inflammatory, but not just any fiber, fermentable fiber, which comes in the form of vegetables, some legumes, certain nuts and seeds, but typically not as high in grains or the bran of grains. So look at inflammation as something that can happen from an infection, from some type of trauma, but by and large, too many of us suffer from inflammation because we eat foods or meals that just don't have enough fiber in them.